Today, I'm appointing a Deputy Ministers Committee that will be co-chaired by Deputy Minister Laurie Hall from Emergency Management, British Columbia, as well as Stephen Brown from the Ministry of Health. This Deputy Ministers Committee will guide a whole government approach to this pandemic and ensure that we are as prepared as we could possibly be. I believe that we're on the right track, but we need to be vigilant, and I want to give British Columbians every confidence that the people here are at your disposal to give you information as it comes forward.
We have updated and are ready to use our BC Pandemic Provincial Coordination Plan as necessary as the situation evolves. Well, we are not at this point yet. BC is ready and willing to use emergency powers should they become necessary, as set out in the Emergency Program Act and the Public Health Act. At present, we are focusing on 4 key areas. They are as follows. 1, protecting the population. 2, protecting our most vulnerable citizens. 3, protecting health workers. And 4, supporting our healthcare system capacity. The current plan, the current work has been, since we established the committee, been in place for 6 weeks. We have, as has been mentioned, 21 positive tests on approximately 2,800 samples. 1 person currently in an acute care hospital. So we are currently and clearly in the containment phase. But it is our responsibility and the Premier's direction that we have been preparing for a month for a more serious situation as it develops.
But we really do need to think about what would happen and what would it look like and how will we respond if we start seeing some of those other scenarios here in British Columbia. So we need to take the measures that we can to do our very best to protect the citizens of British Columbia, everybody who is here in BC, but also to ensure that our healthcare system is protected and is able to care for people both who have this disease, if it progresses and we get more people who are ill with it, but also to effectively care for everybody else who needs our health services. And that's what the plan here is about.